Hello, Mr. Ben. So we are still on our series, about the pharmacy process in Canada, and we are very happy about what we are learning, so that our fellow pharmacists will really appreciate what is going on. So, in one of the videos, you mentioned the various exams, and I just want to recap so that we know where we are. So, you mentioned the evaluation exam, you mentioned the MCQ Part 1, the MCQ Part 2, or the OSCE exam, and then the jurisprudence exam. So yes, in this video, can you kindly walk us through what each of these exams stand for and what candidates should expect so far as the exams are concerned? So please, the floor is yours.
Okay, thank you so much, Dr. Bruni, and our hearers and our viewers. Again, it's great to come to you again and explain these things in detail. So the first exam is the evaluating exam.
Okay.
And it's just as the name sounds, because we said it in the last episode that pebc has to evaluate the documents and say, in a way, prove that whatever it is that you said in terms of your learning is actually true.
Okay.
Now, one of the verification purposes after they've cleared that is to now say that, okay, either you've been a pharmacist and you've been practicing for some time and now you're kind of transitioning into Canada, or probably you went to pharmacy school, got your pharmacy license, practiced, and then maybe you veered off to something else, and then now you're coming back. So what they do in the evaluating exam is to give you a test that in a way proves your learning in university. So that's where you're going to see the very details of things that you actually did, whether it's a 4, 5, 6 year course in university. So it actually touches on the very basics of pharmacy. So you would see things like, when it comes to pharmaceutics, you're going to have things like tableting, and you want to be looking at things like, okay, do you need a binder and a tablet, and what does it do? What is friability? If you're carrying tablets from one place to the other, how does it withstand pressures to make sure that the drug is still wholesome? And then you're going to be looking at, maybe even in terms of chemistry, in terms of calculations, in terms of organic chemistry, that's why they talk about the actual basics of what pharmacy school is all about, right? So in the evaluating exams, usually you're going to be seeing things that you did in school.
Oh, okay. So like things you did in pharmacy school.
In pharmacy school. So basically it's saying that we are taking you back to school, and whatever you did for 6 years or 4 years, we want to see that you're back at that level before you continue and build upon that. And that's what evaluating exams is. And I know a lot of people throw it out there, especially for foreign trained pharmacists, where they go like, they don't think that is important. But for me, as a foreign grad who's practiced here for over a decade, I still see the importance of that. Because sometimes some people have actually left pharmacy practice before coming in. And so we need to get you back on track to say that you're continuing from school, basically. And it's not an exam that is, I would say, is out of reach. If you've been to pharmacy school before, you can do it again.
That's wow. That's interesting. So I have a quick question. What are the components of that exam? Is it a 1 hour exam? Is it a 2 hour exam? Like, how many hours is that exam?
So usually right now it's about a 3 hour exam. And right now they are still writing 150 questions.
For the evaluation exam.
For the evaluation exam. In the past, when I did my evaluation exam, we had to do two 150 questions.
Okay.
Yeah, but now I know it's just 150 questions, and then it's at a sit-in, and then you finish the exams, right? So the other components that I should add to that is they still also look at pharmacy practice as part of that exam. So there are some basics that will come in that evaluating exams that just looks at pharmacy practice in Canada.
Awesome.
Yeah, but
Okay.
most of the time it's more the chemistry you did, it's more the physics you did at school, it's more the pharmacology you did, the physiology you did at school, it's more the organic chemistry, the physical chemistry, like all of this together is what they do test you. But the good news is that there are resources that are available, and then there are some preparatory courses that are available that I'm sure MedCognito is looking into it. And in the near future, I'm sure we're going to be having a course
We're going
from
to
that.
do that. We're going to do that.
Yeah.
We're going to do that. Okay. So the questions in the evaluating exam, are they MCQs or like what's the nature of the questions?
So the nature of the questions are multiple choice questions.
Oh, okay.
Yeah, so then usually at first they used to give you five multiple answers and you have to choose from one. But now they do only four. So that's
Okay.
four A, B, C, and D, and then you choose one. Yeah,
Okay,
so
good.
that's all for the evaluation.
Okay. What about the part one, the MCQ part one?
So the MCQ part one is a very tricky one, and I say it's a very tricky one because that actually begins to go in depth and it's more structured towards practice in Canada.
Okay.
So normally what I say is that the MCQ part one is the sum of the knowledge that you have acquired in school and actually applying that into real patient's life
Okay.
or into real pharmacy environment. So
Okay.
the MCQ part one, it has various competencies in the exam. And at first, there's about nine competencies at the moment, actually, that covers that exams. And these competencies make sure that it's covering every aspect of pharmacy. So you're looking at the therapeutics, which is the main part of the exams.
So that's
So
therapeutics.
the therapeutics is
Okay.
usually the main part of the exam, but then that's not the entire part. It looks at things like ethical principles. Once you are practicing, what are the ethical principles that will guide you as a pharmacist? It looks like things like professionalism. How do you relate to people in the pharmacy environment, whether it's in a community or whether it's in a hospital or whether it's in an academic setting? How do you relate to people? And so how your professionalism comes to play. And they have a way of testing pharmacists when it comes to your professionalism. They are looking at things like distribution because pharmacists are dealing with a lot of medications or a lot of drugs. So we look at drug distribution, and that's also part. How do pharmacies outsource their medications, whether it's in a hospital formulary, whether it's in a community pharmacy? How do they outsource medication, and how does medication go from a pharmacist who's outsourced it from a middleman or from a manufacturer to a patient? So these are all part of the exams, and the part one of the MCQ goes into detail to make sure that a pharmacist is actually ready to practice, right? So, and that's what I call the therapeutics or the actual pharmacy knowledge on paper.
So
Right?
does that
So
mean this is more like a practical
it's a practical exam.
exam?
So in
Okay.
the MCQ, you're not going to get. So let me just use an example to kind of
Okay,
explain this.
sure. Give
So
us the example.
example, we say, okay, what's in the evaluating exams, they're just going to say, what's the mechanism of action of, let's say, statins as a drug? So then you're going to have A, this, B, that, and then that's where you have, okay, that's HMG CoA reductase inhibitors. So you're going to just choose that one. But
Okay.
then when you come to the MCQ, now they're going to be asking you questions to a certain patient who has a certain lab results that shows ALT is this, AST is that, and then their lipid profile, LDL is this, that, and that. And then this patient comes to your pharmacy, is allergic to this, or has a certain intolerance to that and this and that, and then they'll give you a list of medications used for lowering cholesterol, and then you're going to choose what is appropriate for this patient. So then it kind of lifts that statin out and now looks at a patient in question and see if it's appropriate for us to give this particular statin to the patient.
Okay.
That is the MCQ part 1.
Okay. And so
That's how
now,
it differs from the evaluation.
okay. So you just mentioned that the evaluation exam has 150 questions. What about the MCQ part 1?
It's exactly the same as well.
150 as well.
Yes. It's just that the nature of the questions of the part 1 MCQ, it's more comprehension.
Okay.
The evaluation is more bullets, it's more okay, so these are a list of ingredients of this particular formulation. Tell us which one is the binder.
Okay.
But then in the MCQ part 1, it's going to give you a whole story that you have to read, and it's very particular to a patient, or it's very particular to a setting. And then you have to apply the knowledge that you have as a pharmacist in answering these questions. So I would say if they put a booklet for, right now, these things are computerized, but if they had to put a booklet for the evaluating exams and the MCQ part 1, the MCQ part 1 might have twice as much papers than the evaluation, because that will have more stories, that will have things that are peculiar to a particular patient or setting.
Okay, so now we finished the evaluation exam, we finished the MCQ part 1. What about the MCQ part 2?
So the MCQ part 2, normally I say is the MCQ part 1, but this time is oral exams.
Okay.
And then the way it relates to the part 1 is that most of the time too, in the part 1, they would have a scenario created on paper, and then you have to choose. But then in the part 2, you actually have the real patient in front of you, or you have the real healthcare professional in front of you, or you have the real setting that you would face in the practice in front of you, and you have to interact with the person and then come up with a solution depending on what they are looking out for.
So remember that you also mentioned the jurisprudence exam.
Yes.
So now we've done the evaluating exam, the MCQ 1. By the way, the part 2, how many questions will the candidates also face?
So in the part 2, instead of questions, it's actually divided into stations.
Stations,
So,
okay.
yeah, so they create scenarios, real life scenarios that possibly a pharmacist can face whilst practicing. And usually I categorize them into about 5 main groups, but then it's anywhere from OTC consultations. If anybody comes up to you in a pharmacy and then ask you about a medication over the counter that you can give to them, how would you behave as a pharmacist? And then it goes to your therapeutic knowledge in terms of how you're going to apply that in the pharmacy. So they are going to assess that. They look at how you come up with a decision in terms of maybe saying, I'm going to release this medication to you that a doctor has prescribed. And then they look at settings where you have to deal with other healthcare professionals, how you're going to do that. And then they look at non-interactives in terms of how pharmacists transcribe prescriptions that have been written by doctors. And because we do everything here in Canada is on a computer system. So if a doctor writes a prescription, a pharmacist has to transcribe that into a system and make sure that whatever the doctor has written is exactly what they're going to issue out to the patient. But before they do that, they need to ensure it's appropriate, because at times what a doctor has written, maybe they may have missed 1 or 2 things, or maybe they didn't have knowledge of certain things about the patient, and the pharmacist has to determine it's appropriate for the patient. So they're going to put you in all these different scenarios. and make sure that you're ready for practice.
Awesome. So now, take us to the jurisprudence exam. What should they expect?
Jurisprudence exams basically is the laws that govern pharmacy practice within a particular jurisdiction. So, example, I come from Ghana, West of Africa, and in Ghana, there's only one body that, in a way, takes care of pharmacy practice. But in Canada, we have 10 provinces and 3 territories, and each province, in a way, works as an independent or an autonomous body. So if you come to Canada, I can tell you there are 10 pharmacy governing bodies in Canada. And then depending on the province, the laws might be different. So there are certain things that can be done in one province, but then another province, they don't do that. So the jurisprudence exams, we call it the law exam. It's in a way learning the regulations and the laws that govern pharmacy practice within that particular jurisdiction or province, as we term it here. So we normally, in short, we say it's the law exam. And in a way, you're going to learn what are the laws that govern pharmacy practice within that particular province. And that's what the jurisprudence exam is all about.
Beautiful. Mr. Ben, in order not to let this video be too long, I think we will also dedicate a whole video talking about the various books and resources that we need to focus on so far as each of these exams are concerned. So, thank you so much for highlighting all these things, and it's been awesome listening to you break down these concepts. So the evaluation exam, 150 questions, MCQ part 1, 150 questions, MCQ part 2, that is the OSCE exam, and then the jurisprudence, which is the law exam. Thank you so much for shedding so much light and coming to us with so much knowledge about the process. We'll see you in the next video. Thank you very much.
For sure. Thank you. Okay.